Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by Elizabeth Richmond, nurse practitioner, Nicole Brandt, pharmacist from the Center for Successful Aging at MedStar Good Samaritan Hospital in Baltimore, as well as Annalise Massey, physical therapist, and Deanna Cho, social worker from the Center for Successful Aging at MedStar Montgomery Medical Center in Olney. Today, we're going to talk about the Center for Successful Aging teams at MedStar Health, how they care for older adults who have complex medical and social needs, what those needs are, and how the center's team approach was created to help, why it's important for our caregivers to be involved, and how the 4 M's, you're going to hear a lot about that today, can focus on the person first and their disease second. When the 4 M's are implemented together, we deliver the highest quality of care to our older adults. So if you or someone you love is an older adult with complex medical and social needs, we invite you to stick around. Be sure to share this broadcast with your friends. You can watch the replay on our channel if you did not catch it live, and ask your questions for our providers in the comments below. So first of all, thank you so much to our panel for joining us today. We really appreciate it. Let's take a moment. I'm going to go around and ask you to introduce yourselves before we get into our questions. So I'll start first with Nicole. You want to introduce yourself?
Yes, thank you, Karen. Thank you for this opportunity. My name is Nicole Brandt, Dr. Brandt. I'm a pharmacist here at the Center for Successful Aging, working with our interprofessional team, and really fortunate to be with Elizabeth Richmond.
My name is Elizabeth Richmond. I'm the nurse practitioner here at the Center for Successful Aging, and we're very lucky to work on this interdisciplinary team together and be here to answer your questions today.
Thank you. Annalise?
My name is Annalise Massey, and I'm the physical therapist here at the Center for Successful Aging at MedStar Montgomery Medical Center. And I'd like to welcome Deanna Cho, our social worker.
Hi, and I'm Deanna Cho. I'm the social worker with the MedStar Center for Successful Aging. I'm very glad to be here today with all of you.
Wonderful. It's good to be with you all. Thank you. So we're going to start with Elizabeth with you today. Can you talk about what the Center for Successful Aging is?
The Center for Successful Aging is a comprehensive care model. What we like to call it is a one-stop shop. We like to streamline the care from the very beginning until the end, and we address all the needs of older adults, from physical to psychosocial to mobility, and we'll get into a little bit more of that today.
Awesome. Thank you so much. And what makes it different than any other geriatric practice?
Yes, great question. So our practice, we work with an interdisciplinary team. So we have a lot of specialists on board, which is great. We have a nurse practitioner. We also have a pharmacist who helps with medication reconciliation, to simplify medication lists, and then also to really hone in on all those adverse reactions that could cause different things like falls. We also have a physical therapist to address the mobility and frailty. And we have our social worker and community health advocate. So everything we aren't addressing from a medical standpoint, we get them in as well. So it's a great model of care, and we really address all the concerns of older adults.
It's a one-stop shop, one location for all the needs that you have. So that's really wonderful. Thank you so much. Well, what about primary care providers? How can they work with the Center for Successful Aging?
So there's a couple different paths that we offer. A lot of times in the traditional primary care practices, their appointments may be 15, 20 minutes, and it's hard to address all those complex needs of older adults. So many primary caregivers, they refer to us to take over that primary care role to really address all the different concerns and complex needs that older adults have. The other option that we tend to sometimes do is do what we call a geriatric consult, and that may be from a mobility and frailty standpoint, from a mentation or memory concerns, and we kind of package all the different interventions that we would like to implement, and then we give that information back to the primary care provider. So we usually see those patients either one time or as needed, or as often as every 6 months, but we work closely with those other primary care providers to help, lighten their load a little bit, and then also address those other needs.
Wonderful. Thank you. So I heard a couple of the M's there that you just mentioned. So I'm going to turn it over to Dr. Brandt. Can you talk about, we all want to know, we talked about it in the intro. What are those 4 M's? Can you kick us off? And then we're going to hear from each of our panelists about the 4 M's.
Absolutely, Karen. Thank you. The 4 M's are really a framework. And this framework was established by the Institute for Healthcare Improvement in collaboration with the John A. Hartford Foundation, the American Hospital Association, and the Catholic Health Association. And this framework, the 4 M's, as we're favorably going to be discussing today, starts with what matters to the patient. And we often say what matters to the patient is the most important M of them all. It frames out the conversations that we'll have today, but really the conversations we have with older adults and their caregivers when they come in to the Center for Successful Aging. The other 3 M's are medications, mentation, and mobility. So collectively, we focus on all the needs of the older adult, and this gives us the opportunities to bring in multiple professions, to bring in the team, to really focus on that person, patient-centered care, which is really the hallmark of the care that we provide. The important thing about this movement, this age-friendly health system movement, which encapsulates the 4 M's, is that it's been going on for several years now, nearly 7 years actually. And MedStar Health was one of the early action communities in implementing the 4 M's, because we have the Centers for Successful Aging here in Baltimore and now down in Montgomery County that really can help shepherd this work. And we're really excited to talk about that today, but also just to talk about how MedStar Health is really leading, again, person-centered care for older adults through the Center for Successful Aging. And so with that and what matters, I'm going to turn it over to Deanna Cho, who is our social worker, who can start the conversation with what matters to the older adults.
Thank you.
Thanks so much, Dr. Brandt. So to spell it out, the what matters is about knowing and aligning care with each older adult's specific health outcome goals and care preferences. And that really includes, but it's not limited to, end-of-life care and across the settings of care. And here at the Center for Successful Aging, we use what matters as an approach to care. We start with what's important to you. How can we support you? And we want to more deeply understand our patients' concerns, their preferences, and their goals, so that, again, they get the healthcare that they want and that they need. Once we understand what matters to our patients, we can create care plans and provide recommendations that are in line with our patients' goals. For example, one of our patients recently, they wanted to travel back to their home country for a month, and we devised a care plan to make sure that that happened in the safest manner possible. I also want to add that when we're using the what matters approach, it's super important for us to also know how an older adult's caregiver is involved. How can we support and partner with our caregivers who are already working so hard to help their loved one? And I just want to add this other note about the fact that we believe so much in this, the 4 M's and the what matters piece of the 4 M's, that we have this great interdisciplinary team, a team of professionals with these different backgrounds who are experienced in geriatrics and really interested in getting the fullest possible picture of our patient. The social worker is a part of that team because knowing what matters means, for my end, looking at those pieces of a patient's life that are outside of their medical diagnosis, like what does your support system look like? What experiences are you carrying that are helping or hindering you in carrying out your goals? Do you have the resources and support that you need to meet your goals? So I'm happy to answer more questions about our use of the what matters approach, but I'm going to hand it off now to Elizabeth to talk about mentation.
Okay, thank you. Elizabeth?
Yes, thank you very much. So in terms of mentation, one of the standard cognitive screenings that we provide at the Center for Successful Aging that oftentimes is overlooked, or there may not be enough time at traditional primary care practices, is actually testing everyone's cognition at baseline so that we can identify any cognitive changes. The other thing that we also screen for is any underlying anxiety or depression that can often complicate or make their medical decision or medical complexities a little bit worse or have symptoms for it. So we have screening tests to address both of those. And then we also work directly again with the pharmacist and the social worker to help the patients be as cognitively independent as possible. And if that isn't a possibility, then what we do is figure out ways that we can foster their independence while also making sure that they're safe in their current living environment and with their current caregiver. So that is what we do for Mentation. So I will pass it to Nicole Brandt.
Awesome. Thank you, Elizabeth. So again, here at the Center for Successful Aging, we as the team, again, focus on what matters to the patient. So when we talk about what matters, we know that medications in older adults often increase in numbers. They increase in complexity, both things that are both prescribed as well as over the counter. And that's often due to the medical conditions and the many medical conditions that we're treating. And so we need to be mindful as a team that medications can help improve the quality of life, help improve and meet the goals of care, but they also can negatively impact someone's memory, can potentially negatively impact someone's mobility, may also negatively impact their quality of life because they're making them too sleepy. And as Deanna started off with the story, it's not uncommon when I'm seeing older adults and their caregivers here that they come in with bags of medications prescribed by multiple providers because they're trying to navigate a very complex medical environment where they're seeing multiple specialists for multiple disease states, prescribing multiple medications. And so this team approach really helps us to carve out the conversations that are often too complex or not enough time to have in terms of identifying cost or access issues or barriers to getting their medications. So I say medications are constantly changing because the care and the care needs of our older adults are constantly changing. And so when they come into the Center for Successful Aging, during that initial visit or during a consultation, we ask them to bring in everything. And it often is an opportunity to really clean out medications that are no longer needed to prevent misadventures from happening with medications. It also gives an idea of maybe, again, to adherence or not taking their medications correctly. And that could be simply that they're putting old medicines in new bottles or mixing up medications. So it's really important. So we do what's called a comprehensive medication review. And that's led by the pharmacist in conjunction with the medical team to really assess those issues that we identified. Drug-drug interactions, families and caregivers are often asking us about. And could we make this easier? Are there ways we could package the medications to make this simpler, especially if we identify adherence issues? And so that's done initially, and then that's done on a regular basis or as needed, because as we're following our patients longitudinally, that over a period of time, their changes to their medications may happen if they go in and out of the hospital or in and out of the emergency department. So again, communication is one of the pivotal things that helps us work as a team, but it also helps our older adults in terms of navigating their health. And again, medications can often be a communication breakdown. So I think that's really important. And I think the other thing to note is medications can also potentially increase the risk of falls. So I think that really leads us nicely into the next M. And Annalise, if you can tell us a little bit more about mobility.
Sure. Thank you, Dr. Brandt. So I feel very privileged to have the role as the physical therapist here at the Center for Successful Aging. And when I'm first meeting with our clients, I'm really looking at the big picture of their mobility, which mobility is more or less defined as your ability to move or walk freely and easily. And that's really critical to function well and to live independently. And as we age, we experience changes to our mobility, and there could be many reasons for those changes. It might be a physical strength issue. It could be a balance issue. It's just how we're moving differently. So my role is to come in to assess that mobility when I meet with the patient initially. So the first thing I do when I walk into the room and meet with the individual, I want to talk to them a little bit about what's their home setup, what is their support system, do they have family at home, do they have caregivers at home, kind of getting that big picture. I talk to them about any pain that may be limiting them, and if they're taking pain medication, as Dr. Brandt mentioned. What is their falls history, and what is their overall safety in their current environment? Are they falling frequently? Have they had falls that resulted in hospitalization or significant injury? So I need to know all of that to kind of get that big picture. And then I start with my assessment. So I really want to look at their range of motion, their strength, their functional mobility, their balance and their walking, and what things could we possibly manage to impact their mobility in a positive manner. And that assessment starts from the very beginning. When the client walks into the lobby, the medical assistant will come to me and tell me they had some difficulty there, or when it was they were stepping onto the scale, or how did they move into the examination room. So we're kind of starting to look from the very beginning and get a big picture of how they're doing, how they're functioning overall. And then I want to do some objective measures to really kind of identify what their falls risks might be. Are they at low risk for falls, medium risk, high falls risk, and we really need an intervention to prevent them from having potentially that catastrophic fall. And so what I want to do is make recommendations to the patient. So I'll discuss with the other providers what the results of my assessment are, and then make recommendations from there. And it may be that we think they are functioning just fine at home. Maybe they're going to exercise classes at the senior center and we want them to continue with that. Or perhaps now they need outpatient physical therapy, occupational therapy, maybe speech therapy. Or would it be better for us to optimize their safety in their home by sending a therapist into their home? Again, either PT, OT, or speech. So just trying to work with the patient, the family members, the caregivers to really support them to optimize their safety. And then how frequently do I see them? I see them at that initial comprehensive visit where all of the providers are seeing the individual. And then typically every 6 months after that to kind of monitor, how are we doing? Are we still able to maintain our mobility to do what matters? And then I may be called in to consult with the patient if they are here because they've had some sort of functional decline. Maybe they did have a fall, or they had an illness with a hospitalization and somehow they're functioning differently. So as frequently as they need me to see them, I'll go in there and work with them to kind of make those mobility recommendations. My goal overall when I see the individual is really to educate them and their family as to what their falls risk actually is, make recommendations how to make them safer in their own environment, and really support that older adult by identifying and setting more or less daily or weekly mobility goals. I want you to make sure that you're getting up and walking every single day, or you're, in order to be able to care for your grandchildren, I need you to do this, this, and this, and just really give them some goals that relate back to what matters to them so that we have that buy-in and really keep them moving as much as possible. Because that's the key to their success is if they stop moving, then we really, unfortunately, can have problems from that. And really doing everything that we can to maximize their safety and really reduce their falls risk in their own home environment. And like I said, encouraging them to stay as active as possible.
Wonderful. Thank you all so much. I wanted to take a moment to welcome any viewers that just joined us. We are joined today by Elizabeth Richmond, nurse practitioner. We have Nicole Brandt, pharmacist. We have Annalise Massey, physical therapist, and Deanna Cho, social worker, all from the Center for Successful Aging. We have 2 locations, one at MedStar Good Samaritan Hospital and one at MedStar Montgomery Medical Center in Olney. We just talked about the 4 M's, which I think was really great. The 4 M's is really the focus of our discussion today. And those are what matters to our patients: mentation or memory, medication, and mobility. So if you didn't catch all 4 of those, you can watch the replay on our Facebook page. We're also going to publish this on YouTube, so you can check it out there as well. But I did have some questions to follow up with you all on related to those 4 M's. The first question is for Deanna, going back to what matters. And I think that, this is a very important question to ask, because as you all mentioned, everything goes back, and what you're doing goes back to what matters to our patient. The question is, when you have that, when you're getting that information from our patients, is it a conversation that you're having when they come and visit us in person as an office visit? Is it some type of questionnaire that gets filled out? How do you obtain that information from the patient?
What a great question. So we do have intake packets where we ask our patients or their loved one to complete that and give us some information about how they're doing, their medications, any diagnoses. Because again, we may be seeing this patient as a consultation, or they may be choosing to enroll with their primary care. So that intake packet is one big piece of information. Additionally, we've had patients or caregivers call in, email in ahead of time to just say, these are some of our concerns or things that we would like to discuss during the visit. So that's before the visit. During the visit, we often get so much information from the patient, the caregiver, themselves as they communicate with us and our various team members. I think the example that we like to use here is, you have I don't know if it's a team, but you all have your own piece of the elephant where you're feeling the elephant's leg, the trunk, the ear, and we're all feeling these different parts of the elephant to come together and say, this is an elephant. So that to say, we're each getting a slice of the picture of our patient's life and how our caregiver may support them. That's information for us that to create a good care plan for our patients and caregivers.
Thank you very much. That's very helpful. Going back to medication, another one of our M's, that really struck me because I remember my grandmother, before she passed away, she had a bag of medications. I mean, there must have been 25 of them, a whole bag. Plus, she had another bag, a smaller bag. She also had some medication in her purse, and there were other medicines that were on her dresser. And all I knew as a caregiver was, Grandma, you have to take your medication. And she would just hold that bag. And I don't even know if I wasn't confident that she really knew what she was supposed to take. And I'm sure it can be very overwhelming for both caregiver and the patient when you have a bag of medicines and no one really knows exactly what you're supposed to take. So I really appreciated that. I just wanted to share that with you all because I felt like she could have benefited from something like this. And I thought about that as a caregiver at the time. So that's just wonderful. Can you, Dr. Brandt, go back to what are some of the strategies that you all use when it comes to medication? I know you mentioned going through, obviously getting a full list of everything, maybe doing a purge, if you will, getting rid of medicines that aren't needed anymore. Because that's the other thing too. I feel like you just you keep everything. We have the drug take back day. Maybe that's an opportunity to get rid of some things. But can you talk about some other strategies that you use just to make it a little simpler? You mentioned simpler, which I just really struck me because that would have made things a lot easier. Are you looking for opportunities to maybe use pill cases, and what are some strategies that you can share related to medication?
Yeah, thank you, Karen. And thank you for sharing your story about your grandmother. I think all of us, as we're navigating as caregivers, one of the things we might identify is things that are physically very present that just don't seem normal. So as you articulated, multiple bags of medications. So yeah, step one is gathering, right? Gathering information, just as Deanna said, for the intake packet. So patients often self-report on the intake packet what they may be taking, but we still highly encourage them to bring in everything. Because one of the things, Karen, I've seen through my years of experience is oftentimes people are taking a lot of over-the-counter medications as well, vitamins, supplements, maybe some natural products from some of the various stores that are out there. And you need to treat them like any other medication. So again, gathering the information. When they come on site, I think it's developing trust and good communication. So we actually also may obtain their records from the pharmacy to see, is there any concern regarding how they're filling their medications, the cost of the medication. So there's what the patient brings in, and then the additional information we might be able to obtain. And through that, we then see, is there potentially medications where there's no clear continued need, right? That maybe we can stop these medications. A big movement that has happened at the same time with the age-friendly health system is a term called deprescribing. And that basically is getting medications removed that aren't clinically still needed. But just like when we start medications, we need to monitor closely. When we stop medications, we need to monitor closely. And we need to sometimes be very careful on how we stop medications. So, it's something we tell our patients, please don't do on your own, because potentially you could go through an adverse drug withdrawal event. Basically, and we may have seen that with things like substances out there, alcohol, for instance, people stopping abruptly and going through withdrawal. Some of the medicines can cause a really bad withdrawal too. So we look to see if we can de-prescribe them safely together, any medications, again, that aren't needed. We look for drug-drug interactions, and we know that many of our older adults are taking probably 9 or more medications, whether they're prescribed or over the counter. So there's probably some sort of drug interaction. The key thing about looking at it by a medical team provider is, what are the clinically significant ones? And I think that's why it's so important, not just to run things on computer software as caregivers, but really to talk with the medical team to discern which ones are clinically meaningful. And then we can look to see if we can simplify, right? And there's some medications that we could switch to that are just once a day. So say if you're a caregiver, it's easier to give medicines once or twice a day than 4 to 6 times a day. So we've done a lot of movement in terms of med optimization to simplify medications. And we've also worked really closely with our social work team and medical team to help address the cost issue. Because every time you write a prescription, there still may be a co-payment or co-insurance. So we may need to look, is there ways that we can, again, use a cheaper alternative? Because cost is a concern, even if you have insurance. And some of our patients may not have insurance. And in some cases, we've packaged medications to help people remember to take them if adherence. So you refer to a pill box. Yes, pill boxes might be helpful, but if there's not someone who's consistently filling them up and someone who may have some cognitive issues, they can become very problematic. And I can tell you, Karen, through the years, I've seen patients put all their medicines in one of the little containers and not use a pill box correctly. So whether we use a pill box, we use special packaging, and there's lots of services out there nowadays, we still have to make sure that our patients can use those. And I'll give you for instance, a gentleman came in last week. He brought in all of his medicines. We had packaged them in blister packs, but because of his dexterity and his weakness in his hands, because he had had a stroke, he wasn't able to open them up. So it seemed like a good idea, right? Let's put them in a package, but if they can't have the ability to open it up, and he got more confused by it. So whatever intervention we put in place, working with the patient and or their support team to see if it's really working. So those are some of the tactics we take here. But I think the important thing is not one intervention works for everybody, and it really needs to be individualized. And that's why doing these plans of care and revisiting things that we put into place over time is really important, because our care demands change depending on what's happening.
Sure. Thank you so much for that. That was really helpful. Sounds like, there's lots of different ways that can be done. It just depends on the conversation that you have with the patient and what their needs are and what matters to them. I have a question from Paula that came in from Facebook. This probably relates to all areas of all 4 M's. So she didn't specifically say which one, but how do you all handle resistant patients? So parents who refuse that they need assistance. There's probably some stubborn older adults out there. I can see myself being one of those people when I get older. But how do you deal with that? Maybe we can go to each of you and you can talk about that, because I'm sure it can be experienced in any area. Let's start with you, Deanna.
That's another great question, Karen. So from my experience and from working with this interdisciplinary team, I think it's been very helpful because resistance can come in a variety of different areas. So resistance to take your meds as directed, resistance to stop driving the car, resistance to maybe identifying with a diagnosis that's been given to you or shared with you. So, like you were saying, there's no one answer for this. I think it's usually coming to, does your loved one have the ability to make decisions in regard to X, Y, Z? And if they do, then let's have a conversation about how can we manage the frustration or maybe the safety concerns in this particular area, because sometimes it's just allowing someone to make the decisions that they have the power to still make until they see differently, and supporting our loved ones or the caregivers through that experience, which isn't easy. It's not an easy experience to deal with resistance when you're trying to just help your loved one. So from my perspective, I think that's where the conversation starts, is where is your loved one able to make decisions, and how can we work through some of the decisions that we may not agree with?
Sure. Thank you. Annalise, what about you from a mobility standpoint? I'm sure, there's some resistance that you see there where it's, I got it, I don't need help, I could do it myself. But
Exactly.
then there's the risk of fall. So how do you handle that in your area?
Yeah, that's a frequent concern that we have as physical therapists. We meet with that resistance when we're recommending an assistive device. So if it's someone that's walking independently without an assistive device, but they're starting to trip or stumble, and we may recommend a cane, or maybe it's a walker. They were walking with a cane and we're progressing them to the walker. There is frequently resistance, and I've had different individuals admit it's a vanity issue. I don't want to be seen. I don't want to be viewed as older. It may be a pride issue, and they just don't feel like they have that need to use that assistive device. So just kind of coaching them on, this is just going to optimize your safety as much as possible. Talk to them a little bit about the fact of what the risks are, and basically stressing the importance of, I want you to avoid a potentially catastrophic event. So you're living at home in your independent lifestyle. I don't want that to be taken away, not by your choice, because you've now fallen and had a hip fracture, and unfortunately you can no longer live on your own. So we're kind of giving that harsh sermon or lesson right from the get-go and saying, this is a choice that you have to make. It's my strong recommendation that you would be much safer utilizing this assistive device. And the same thing with kind of encouraging them to take advantage of therapy services. That's what we're here for. We're really here to work on balance and mobility and safety and minimizing falls risk. And they may not be at that point when they meet me for the first time, but perhaps when I see them the second or third time and say, I'm still really hopeful that you'll take our support and go see a physical therapist or an occupational therapist, because I really feel like we have the ability to help you be safer, and kind of meet them where they are. When they're ready, they'll accept that kind of guidance and that support.
Yep. Thank you very much. Even just being there with them, allowing them to the level that they can do the things that they can do independently without risking their safety. Another personal story that came to mind with that is with my grandfather. He wanted to walk into his apartment by himself. He does use a walker, and we did that, but we just kind of let him go, and he ended up falling, unfortunately. So it's even just being there, even if you're not pushing your loved one in a wheelchair or allowing them to walk with the devices that they have, but even just kind of being there with them. So if you feel like they're about to stumble, you can get them as quickly as possible, rather than just saying, okay, fine, I'll just let you go. I'll let you do what you want to do. It's just taking that moment and saying, well, hold on, let me just at least be right behind you, even though I'm not right there. So as caregivers, there's that, you want to allow them to do what they want to do, but there's still a need for you to at least be there.
Sure. And I will talk to the individual and say, look, I'm giving them full permission, whether it's the husband or the wife or the daughter. I'm telling them they're the boss, and they're going to kind of remind you of these things that
Yeah.
I want you to do. I'm the bad guy. They're just kind of my voice at home to remind you, I really would prefer that you're using that walker to be safe as
Yeah.
possible, or that you're allowing them to kind of help you when you go to get into the bathroom, or when you're getting in and out of bed, or in and out of the shower. We really want to support them as much as possible. Allow everyone to do as much as they can, but to do it safely. I'm giving permission to the family to say, look, I'm the bad guy. I'm the one telling you this, but I want you to be the coach or the boss at home and encourage that safe behavior.
Yep. That's so important. That safety piece is so important. One fall can do a lot of damage. What about you guys, Elizabeth and Nicole? What do you all do to help with resistant patients?
Yeah, so I think definitely the first thing that you need to do is establish that trust. Usually, if there is resistance, it's for a certain reason, right? So establishing the trust, establishing the rapport, and then trying to understand where they're coming from. For instance, if a patient isn't checking their blood sugar, well, you say to yourself and to them, what's the barrier to check your blood sugar? And at that point, they may have come from a different practice or a different provider, and their instructions is to check blood sugar 4 times a day and give insulin, 3 to 4 times a day. I mean, for anybody that would be it's treatment burden, it's a lot of stress. So, working on ways to meet them where they are, if they're not willing to maybe check blood sugar that much, which personally, I wouldn't even check it that much. So I think it's just seeing if their treatment plan is even manageable. I think the other thing too is, using the language that they're familiar with. I think when they come to the provider's office is a lot of times agreeing with providers, maybe if they are or aren't doing what is needed. So I think just trying to say, we're not here to necessarily be the bad guys. We're here to understand where you are, what your goals are, why your goals are this, and what does truly matter to you. And then it seems like a lot of the resistance or, stubbornness, kind of the walls come down a little bit. And I think in terms of mentation, addressing their underlying mood as well, because a lot of times, especially in the older population, mental health is very stigmatized. So, if you say any history of depression or anxiety, it's no right away. But if you, they'll describe it as nerves or different things like that. So trying to use the language that they're most familiar with and comfortable speaking about. And I think kind of taking all that, you'll, even if a patient is a little bit resistant or stubborn or anything like that, it's really just knowing that you're there for them. And these are just the recommendations and coming up with a plan. You need their buy-in and a little bit of bargaining as well to really get the outcomes for the patient. And again, it's just making the patient the center of the care.
Thank you so much. Anything to add, Nicole?
Yeah, absolutely. So I want to just take a piggyback on what Elizabeth said with respect to mentation, mood, and memory. So I would say that one of the amazing things that the Centers for Successful Aging does really well is focusing on the memory concerns, complaints that a family might be picking up to work up for that older adult through a bunch of different assessments. And I mention that because depending where the individual is in their stage of their neurocognitive disorder or dementia, they may become more resistant to medications. And so when someone has more advanced disease, it's not uncommon sometimes for them to become agitated or potentially delusional. And that could be with giving medications. And we've had many stories through the years where caregivers are like, they're accusing me of poisoning them with the medicines. So then we work as a team to really figure out, again, what are the needs? What are the goals of care? And can we, again, simplify or address either those interventions, whether they're medications, maybe it's the bathing and the cleaning up, maybe it's the, the mealtime, but different tactics. And I think that's what's really important is that assessment of why there's resistance. And there's certain cases where the resistance may be really aggravated by those medical conditions, such as dementia.
Thank you so much. All wonderful advice. Great question by Paula. Thank you so much. Another question from our viewers. So we know I mentioned earlier in the broadcast, we have the Center for Successful Aging at MedStar Good Samaritan Hospital in Baltimore, and also MedStar Montgomery Medical Center in Olney, Maryland. The question is, do you serve all counties in Maryland? You can, yes, go to either hospitals to get care from the Center for Successful Aging, but does anyone want to address that? I saw some head nods. So
Yeah.
we serve all counties in Maryland, correct?
We do, Karen, and we've had people drive several hours. I've been impressed from Southern Maryland. We even had someone take a plane ride to see us.
Yeah.
So
Wow, great.
we are here to serve. I mean, we feel really fortunate that we can work together and provide these skills and these resources for families throughout Maryland and maybe even beyond. So yes, we are available.
And I think to
Awesome.
piggyback off of that, we have the Geriatric Consult. So even if you live very far away and you just want our input, you can still have the services. So the social work team, the physical therapy team, the pharmacist. So you're still connected in that way, but it's not like we require anybody to come every 3 months or 6 months. We can do a one-off Geriatric Consult to try to address all the needs as quickly as possible.
That is great. Thank you so much. Before we wrap up, I wanted to just ask you all to give us what is a key takeaway that you would like to share with our viewers. We talked about the 4 M's, which are all very, very important. Obviously, aging is important to care for yourself and your loved ones. But I'm just going to go around and ask you all just to wrap us up with a key takeaway for our viewers that are watching today. So I'll start first with Nicole and Elizabeth. Do you want to share your key takeaway?
Yeah, sure. I think we talked a lot about the patient and the patient-centered care, but another thing that we really do address in terms of mentation and the patient is we also address, the caregiver and the caregiver stress and caregiver burden. So, we're not only working with the patient, but we're working with the family and loved ones to really, help consolidate the care and to help you be able to serve the patient as best you can. And we also have caregiver support groups and just different outlets as well, because we know that it's a full-time job to be a caregiver. So we're not only just addressing the patient, but also the family as well.
Thank you.
Yeah. Thanks, Karen. I think that's a great point to summarize, patient-centered care, but being an advocate for your loved one and feeling like your voice is heard is so important in healthcare. So, and I think, one of the things, again, that we talked about today was the 4 M's, because it helps frame out those communication tactics and what matters to the patient. But I really would encourage anyone listening to this program is to either advocate for yourself, advocate for your loved one, and this type of care environment really helps you to navigate a complex medical environment.
Thank you so much. Annalise, do you want to give your key takeaway, final comments?
I think the biggest thing that we do here as far as from the non-medical side is we're really working so much on education. And I think that we do a great job of providing resources to not only the patient, but the family and the caregiver, and how can we help you to be as successful as possible. And whether that means, we're facilitating equipment that they may need at home, or, connecting them with psychological services, or, putting them in place and referring them directly and kind of giving them the support to get to the therapy services. But really, it's just that education of having as much availability to the resources that are out there that most people may not even know exist. And we're just really trying to do our part to kind of make everyone aware of all the things that are out there to kind of decrease those barriers and really optimize success as we grow older.
Thank you so much.
Sure.
Deanna?
The only thing I want to add on top of these awesome comments is that for our caregivers, we love to support our caregivers because we know that you're oftentimes the only person, or maybe the main person, that's helping to support your loved one and support those care plans. And part of the center, both centers have consult rooms where we can meet specifically with caregivers one-on-one and go over concerns in private, because I know that sometimes that's challenging to say in the middle of an appointment. And just to, again, speak on the navigation piece. So we specialize in geriatrics. That's all we do. What happens as we grow older is that there's just a wealth of aging related and healthcare related changes that you may experience. And it can be very overwhelming. You can feel lost as you transition from different challenges. And that's where I think the different centers for successful aging are really great at providing that support and that guidance through your aging related or healthcare related transitions.
Thank you so much for that. Thank you all so much for being here today. I learned a lot. I know our viewers learned a lot. Again, you can watch the replay on our Facebook page. We're also uploaded to YouTube. There'll be lots of ways for you to rewatch this broadcast. If you missed anything, or if you want to rewatch and relearn, the Center for Successful Aging, as I said, is available at both MedStar Good Samaritan Hospital and MedStar Montgomery Medical Center. So if you'd like to request an appointment, you can call them for the MedStar Good Samaritan Hospital Center for Successful Aging. You can call 443-444-4720. And at MedStar Montgomery Medical Center, you can call 301-570-7400, or you can visit us online at medstarhealth.org/successful aging, and we'll put those phone numbers and that URL in the comments so you can easily access those. Thank you again. Really appreciate the time and the education. We hope everyone has a great rest of the day, and here's to a successful aging life. Take care and stay well.
Thank you.
Bye.
Bye-bye.